How to deal with dry cough in babies. Keep your baby hydrated. Fluids help thin mucus and keep the throat moist. Offer breast milk or formula frequently. For older babies over 6 months, small sips of warm water can also help. Use a humidifier. Dry air can worsen coughing. A cool mist humidifier in your baby's room adds moisture to the air, helping soothe irritation in the throat and airways. Give steam inhalation. Sit with your baby in a closed bathroom filled with warm shower steam for 10 to 15 minutes. The moist air can relieve dryness and reduce coughing. Nasal saline drops and suction. If your baby's nose is blocked, use saline drops followed by a gentle suction bulb to clear mucus. This helps your baby breathe and sleep better. Maintain a comfortable room temperature. Keep the baby's room neither too cold nor too hot. Use light, breathable clothing to avoid overheating. Avoid smoke and strong scents. Keep the baby's room neither too cold nor too hot. Use light, breathable clothing to avoid overheating. Offer warm comfort. A warm bath or gentle chest rub with baby-safe products can relax your baby and ease coughing discomfort. Elevate the head slightly during sleep. Slightly raise the head side of your baby's mattress. Place a towel under the mattress, not under the baby, to help reduce postnasal drip and coughing at night. Monitor for warning signs. Contact your doctor immediately if your baby has trouble breathing, high fever, persistent cough more than a week, wheezing, or vomits after coughing. Consult your pediatrician before giving any medicine. Never give over-the-counter cough syrups or home remedies without consulting your pediatrician. Babies need special care and proper dosage based on age and weight. Causes of dry cough in babies. Viral infections. Most common cause, colds or mild flu can irritate the throat. Dry air, low humidity, or air conditioning can dry out your baby's throat. Allergies, dust, pet dander, or pollen may trigger coughing. Postnasal drip, mucus from a runny nose drips down the throat, causing irritation. Air pollution or smoke exposure to cigarette smoke or fumes can make your baby cough. Teething. Extra drooling during teething can irritate the throat and cause mild coughing. Asthma or bronchial sensitivity. Some babies have sensitive airways that react to cold air or allergens. Reflux, GERD. Acid from the stomach may flow back up, causing throat irritation and coughing. Sudden temperature change. Moving from warm to cold air can trigger coughing spells. Foreign particles or dust. Tiny particles in the air or toys may irritate the throat and cause a dry cough. Thanks for watching Parenting Tips and Baby Care. Please subscribe my channel for more informative videos.